Join us today in Cracking Addiction as we uncover the powerful role of positivity, meaningful activity, and relationships in boosting mental and physical health. So continuing our discussion on well-being, it's now time to look at well-being and its relationship with poor mental health. So we know that poor mental health is associated with obesity, screen time, leisure inactivity, and alcohol consumption. So let's look at leisure inactivity. So we've all been told, or it's kind of ingrained in our psyche about this idea of 10,000 steps as a minimum for health. Well, we need to understand where the 10,000 steps came from. And it was really a marketing campaign from a company called Yamasa, which is a Japanese company that made the Manpo Kai pedometer. And they come up with the idea that the idea of doing 10,000 steps because the character for 10,000 looks like a man walking and is also a lucky number in Japan. But nonetheless, we do need to understand that the number of steps that we do per day is actually inversely related to all-cause mortality. So, for instance, if we compare people who do 4,000 steps a day with people who do 8,000 steps a day, those that do 8,000 steps a day have a 50% reduced mortality. And if we look at people who do 12,000 steps a day and compare those people with those who only do 4,000, again, people who do 12,000 steps a day have a reduced mortality of about 65%. So the number of steps you do is related to reduced mortality, but is also associated with well-being. And it's the opposite of leisure time inactivity, which is associated with poor mental health. We also need to understand that sitting is the new smoking. So sitting, there's a dose relationship between the amount of time that we sit and the increasing incidence of insulin resistance, cardiovascular mortality, and obesity. And we know this because we did originally studies comparing bus conductors in London with bus drivers in London. And of course, bus drivers spend all day sitting down driving the bus, whereas bus conductors spend all day on their feet walking up and down the bus, doing steps and standing up. And they actually had improved cardiovascular mortality. So we know actually that standing for 2 hours a day, for instance, will actually reduce your mortality by 10% compared to those that don't. So sitting is the new smoking, standing is good for you, and the number of steps that you do reduces your cardiovascular mortality. And all of these are parameters that are in opposition to the idea of leisure time inactivity being associated with poor well-being and poor mental health. Now let's look at alcohol consumption. So we know that a harmful pattern of drinking is associated with poor mental health. And we know that drinking harmfully is often occurs because people are drinking to cope with associated poor mental health problems. So it's a vicious circle. So on the one hand, harmful drinking causes poor mental health, and on the other hand, poor mental health causes people to drink more because they're trying to cope with it. So you get this vicious circle. So let's just reiterate the recommendations for alcohol consumption in Australia are 10 standard drinks in a week and no more than 4 standard drinks on any given day. And compare that with the Canadian guidelines that suggest that for you to avoid all risk of harm to yourself and others, you shouldn't be drinking any more than 2 standard drinks a day, albeit that the Canadian standard drink has got slightly more alcohol in it than the Australian standard drink. Now then, let's look at the psychological factors that impact upon well-being, and we need to understand the relationship for the following. So Martin Seligman, actually, he came up with this concept of PERMA, and PERMA stands for positive emotions, engagement, relationships, meaningful activity, and accomplishments. So let's think about positivity. So we need 3 positive thoughts to negate 1 negative thought. 3 positive emotions to negate 1 negative emotion. And so we can actually develop positivity and positive emotional states by deliberate practices. And such practices would include counting our blessings, expressing gratitude, doing acts of kindness, and leveraging past success. So I actually recommend people do a journal where they actually describe in their journal, they write down in their journal every day what gives them joy that day, what 3 things they're grateful for, because remember, 3 positive things need to outweigh 1 negative thought or emotion. And then who do they love, and how did you actually express that love for that individual? So positivity is not some kind of innate thing that you've got within us. It can actually be developed and worked on. And then we go on to engagement. So engagement in a meaningful activity is very important to actually make us feel connected with our higher purposes in life. And we know that a higher purpose is associated with significant benefits, including the reduced risk of Alzheimer's disease, a reduced risk of stroke, reduced risk of heart disease, higher walking speed. And the opposite is true, meaninglessness, having this painful incoherence where we don't know who we are, we don't know why we're here on this earth. That's actually associated with increasing levels of substance use, stress, inactivity, and poor nutrition, which of course all erode well-being. If we look at relationships, there is a neural link between isolation and meta-inflammation. And meta-inflammation is that chronic low-grade inflammation that hangs about like a bad smell and causes more harm than good, and is implicated in the etiology of a vast number of chronic non-communicable diseases. And it needs to be distinguished from acute inflammation, which is very necessary for healing. So acute inflammation, you need it for healing. But if it hangs around too long, it kind of just smolders on. And that's when it starts to cause problems. And that's when we describe it as meta-inflammation. So loneliness and isolation causes meta-inflammation. Loneliness and isolation causes death. It's as powerful and potent a risk factor for an early death as is smoking or alcoholism. And so we know, for instance, that people who live alone, people who are isolated, the people who feel lonely, so even if you're living in a big city and you're surrounded by people, if you feel lonely, all of these factors are associated with roughly a 30% increase in mortality. But loneliness also increases the risk of suicide, increases the risk of stroke, dementia, cardiac events, death, healthcare utilization, reduced immunity, and also increasing amounts of substance use. People who feel lonely and who are also beset by an addiction will actually use more of their substance just for the want of a meaningful relationship. And we need to also include in our concept of psychological well-being the impact of adverse childhood experiences. So adverse childhood experiences include being neglected as a child, being physically abused, being sexually abused, being emotionally abused, and also the definition now includes being exposed to family violence. And these all increase the risks for poor mental health, poor emotional well-being, increasing risks of depression, self-harm, suicidal behavior, but it also increases the risk of physical illnesses. So the risk of chronic obstructive pulmonary disease is increased 2.5 times. The risk of heart disease is increased 3 times. The risk of depression increased 4 times. And unfortunately, the risk of suicide is increased by up to 12 times. And that's if you have what we call an ACE score, an adverse childhood experience score of more than 4. So there's a linear relationship between having been traumatized or neglected or wounded or hurt or harmed as a child, an innocent child, and experiencing significant adverse health outcomes, physical and mental health outcomes, and low well-being in adulthood. That's the bad news. But what about the good news? The good news is that well-being, remember, we still don't know what is defined as well-being, but there are various definitions of it. But nonetheless, however it's defined, well-being is associated with a reduced mortality. So if you've got a high amounts of well-being, you live longer. The absence of flourishing mental health is associated with a 62% increase in mortality. So that's the absence of flourishing mental health. So well-being will actually improve that. Well-being will reduce your morbidity. It'll reduce the amount of chronic disease you experience. Well-being will reduce the amount of inflammation in your body. Well-being will reduce the amount of cardiovascular disease and will improve your survival after a heart attack. Well-being will increase your cognitive function and reduce your risk of dementia. And well-being will certainly reduce the amount of chronic suicidal ideation you experience. So there we have it. To summarize, we don't really know what well-being is. We know that a bunch of physical factors can impact positively on well-being and also negatively on well-being. We know that it's genetically inherited. A component of it is genetically inherited. And we know that well-being is associated with poor mental health, or low well-being is associated with poor mental health. And we know that high well-being is associated with improved physical and mental health. That's all for today, folks. My name is Dr. Ferghal Armstrong, and this has been Cracking Addiction.